Canada's healthcare model is shaping where billions of dollars in medical spending go. Long wait times are pushing more patients abroad, raising questions about lost revenue and system capacity. Dr. Brian Day joins us to share his perspective and what different models could mean for patients as well as the broader economy. Doctor, it's good to have you join us today. Thanks for your time.
You're welcome.
So I think, first of all, can you just explain to our viewers how Canada's healthcare system works? Because I think a lot of people maybe don't understand it. It's publicly funded, but it's not fully public. Is that correct?
Right. Well, I wouldn't describe it as a health system that works. As in British Columbia alone, in 1 year recently, just 2 years ago, they calculated that 4,600 British Columbians died on public wait lists. So it's not working, and I think that's obvious to every doctor and every patient that is suffering on a wait list right now. So it is publicly funded. It's taxpayer funded to the level that is just not working.
So you, correct me if I'm wrong, believe that the introduction of some private healthcare in Canada could take the strain off of the public healthcare system. Can you elaborate on that? Yes.
So Canada is the only country in the world where private health insurance is illegal, and that alone sends a message. We're talking, when we compare our system to countries that offer universal healthcare, developed countries, we come in last in access, last in equity. We come in last in looking after low-income groups, and yet we're at the top when it comes to costs. And I use the sports analogy. If you were the manager or coach of a hockey team and you were at the bottom of the league but spending more than those at the top of the league, wouldn't you look at what those teams are doing and try and learn from their methods? And Canada hasn't done that. We have the only system in the world that operates as a state monopoly and forces innocent patients to suffer and die on wait lists.
What country do you think Canada should be looking at for a reference as to how things should work?
Well, I think we have the opportunity to look at the best. Look at countries like Switzerland and Holland and Germany and learn from their methods. We have a massive bureaucracy in Canada. For a population of 45 million, we have 14 ministries of health. Other countries don't have that kind of bureaucracy. We have, for every public health bureaucrat that Germany has, we have 11. And yet they don't have wait lists like we do, and they don't spend as much as we do on healthcare. So there are lessons to be learned here from other countries. And I think the point, in general terms, the point is we operate as a state monopoly. And there is no monopoly, particularly, I think, a state monopoly that serves the consumer well. And, the fact that governments in Canada have taken the position that they actually own your body and are responsible for your bodily health, that they can make it unlawful for you to look after yourself when they have promised healthcare and then fail to deliver it, and you are suffering on a wait list. To me, this is unconscionable. And the solutions are simple. The solutions are, first of all, put the patients first. So hospitals in Canada are unique in that the hospitals get an annual global budget. So that every patient that goes to a hospital, including an emergency department in Canada, is using up the hospital's revenue. Every other public system, the government pays a premium, a fee to the hospital when a patient visit happens. So hospitals want patients in those developed countries that outperform us. The other thing is of course allowing basically giving patients a choice. Competition just improves any monopoly and converts the monopoly to a system that has to perform better.
And by having a percentage of Canada's healthcare system be private, can you explain how that would help to keep money in Canada and what's happening right now with people who can afford private healthcare and are maybe going elsewhere?
Yes, a couple hundred patients a couple 100,000 Canadians a year go abroad for healthcare every year. That's revenue lost, taxes lost. These patients should be able to stay home and have that care. And actually, the reverse. 2 million Americans go abroad for care. Our public hospitals should be generating revenue by opening on evenings and weekends and treating Americans. We are missing out on this worldwide business of medical tourism. And for those who say, oh, well, this private insurance benefits the rich, the answer is simple and has been illustrated in Switzerland and Holland. And that is that if you are in a low income group, the government pays the premiums for the private insurance for you. I mean, we do that to a certain extent with welfare patients and medications. It is bizarre that Canada's universal health system is the only one in developed countries where you get a bill if you need an ambulance. It's not considered medically necessary by politicians who run the system, and that going to a doctor and having a diagnosis of an infection is covered. But when you go to the pharmacy, you need private insurance to pay for that. I mean, these are ridiculous facets to our system.
It is a big conversation. I know we just scratched the surface of it, but Dr. Brian Day, I appreciate you joining us today to kind of break it down. Thanks so much.